of Health virtual meeting for Tuesday, September 20th, 2020. First off, I would like to welcome Katie Pelland, our newest member of the Board of Health team. She comes to us with a master's degree in nursing and strong background in community care. She joins Nicholas Crowenshield as one of our public health nurses. Both of these nurses will be the names that residents can expect to hear if they are part of any contact tracing due to COVID. So wanted to get that out of the way first. We do have to take a vote from the board members to approve her appointment. Do I have anyone to make a motion?
I'd like to make a motion. Welcome aboard.
Do I have a second?
Carolyn. Hello.
Carolyn, are you gone?
Better? I'm here.
Yes.
Oh, we need you
I
as
second it.
okay. All in favor?
Aye.
Aye.
Katie, welcome aboard.
Thank you.
So we are going to go a little bit off of the agenda. We'll do the approval of the minutes, but then we're going to go to the nurses report because it kind of all goes together with the vaccine. So
You're breaking up, Kathy, a little bit.
okay. Can you hear me now?
Yep. Well, you just went away again.
All right. So we need the approval of the a motion to approve the minutes of July 20th, 2020.
Motion to approve.
Second.
All in
Second. Aye.
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 Minutes approved. Okay, so we're going to move on to the nurses report. Nick?
Thank you. Okay. So a couple of things I wanted to point out on the nursing report. One detail, when I had talked on the nursing report about the kind of COVID case investigations, one thing I wanted to point out to the board was that next month, the next report that I submit, there will be slightly different definitions of what each of these cases mean to reflect the state update of these definitions. And I'll make sure that I highlight that and point it out at the next meeting as well. But you'll see the numbers of the different confirmed and probable cases that Katie and I have investigated since the last board report. Another thing I wanted to point out too is I realized, so the only place in town that was doing testing if a resident needed to get a COVID PCR, which is the nasal swab test, is Norwood Urgent Care. And I had put in the report that it's the only place in town, but technically they have moved, like I want to say 10 feet over the line into Walpole. They're across from the Walpole Mall now, but it's still called Norwood Urgent Care. So that's still the closest place that a Norwood resident can get a test, you know, regardless of whether they're a patient or not, if they find themselves needing to get tested for whatever reason. We did issue one additional camp license. This was about a month ago for a week-long program through the rec department. Blood pressure clinics, we did resume blood pressure clinics. So the next blood pressure clinic is going to be tomorrow at the senior center. What we're doing is we're doing it every other Wednesday at the senior center at 11 a.m. So we're just doing it straight bi-weekly. So I will be there tomorrow at 11 to do the blood pressure clinic. And then we'll do another one in 2 weeks, and we have a good setup there because we're using their rec room. There's plenty of space for everybody to socially distance, and we're able to have one-way traffic. And then the big topic is flu. So we are expecting, and I actually just got off the phone with our Sanofi rep, but we're expecting our first shipment of the flu vaccine to go out tomorrow. It might be delayed to Thursday, but it shouldn't impact us. And then we hopefully will have a second round at the end of the month. So this first round will be 180 doses for the flu vaccine. As I said in the report, we're planning on doing some of our smaller clinics first, like first responders. We'll do senior housing, and then we'll start to plan for how we're gonna, we'll start to plan how we're gonna do, because we're not gonna be able to do the same style of big clinic that we did in the past in October. So then once we get that second shipment, we're gonna start to come up with a solid plan as to how we're going to do that.
Nick, can I interrupt you? Will the second shipment be as big as 180, or will they lessen it? Because 180 doesn't sound a lot to me, but will the second shipment be the equal amount?
Yes, so they're expecting to send us in 180 in the second round as well.
Okay, so off your top of your head, or somebody else might know, what did we use last year, just for comparison, so we'll all know?
Well, I think we ordered 700 doses, didn't we?
Right, last year, we're up 100 from last year. Last year, we did 600.
Okay, so what is that amount going to do? 180 and 180, we're going to need more than that. Will there be a third shipment, Stace or
Well,
Nick?
Yes, so we ordered
yes.
700, so the first one was 180, second one's 180, and we don't know the balance of the next shipments. There could be 3 shipments, 4, we don't know, and they don't know. So we find out by an email
Well,
from
the
them.
360 would cover us though, if we only did 600 and something last year. Right?
So it comes in batches. So what we've done in the past is we would save batches and not give them out and save them to do a large clinic. This year, we're going to try to, we're talking about changing that up, how we do it, our model. We want to get the vaccine into people as soon as it comes in. We don't want to hold on to it. Especially this year, Jones, with the COVID and you can't just say, come to this giant clinic. So we're thinking of doing small batches as soon as we get the vaccine. So with this first batch, like Nick said, it's going to be the housing authority. It's going to be the seniors that live in housing. We're going to go to their housing places. And what happens is
That's good.
through the housing authority. And then after that, we're going to do the first responders. So that will take care of one right off the bat. As soon as we get in it, it's going to be out. And then after that, we're thinking of doing small batches at the town hall in the nurse's office. Again, have people register, fill out the form, come with the form, and that way we know what time and we can spread them. Instead of having one big clinic, everybody show up, because the registration, as you know, takes the longest. And to have you, one person after another, doing registration is not a good thing. We want people to pre-register.
Right.
Good, that's what we're looking at right now.
We need to think about maybe making a couple of dates, as opposed to just right now, we were thinking about just one date to have a clinic. Are we going to think about having multiple or?
Yes. So what we'll do is hopefully pick many dates. So it'll be, we're just planning now, say Tuesday afternoon in the nurse's office. Every Tuesday we will have people register to come into that block. And then we'll have an evening clinic. We'll have different small manageable clinics with pre-registration. So people have numerous opportunities to receive the flu vaccine instead of just that one Saturday.
Yeah. Could we consider maybe at the blood pressure clinics, having people that come to the blood pressure clinic that need a flu shot, maybe they could register and get it at the blood pressure clinic that day? Or is that too much because of, do we have a lot?
Yeah, Kathy, it's a little too much. There may be times that we may be available. That's not something that we want to advertise as a clinic. It would just be too much because the nurses wouldn't have help with registration. They're there to, the registration process is for the flu vaccine. I mean, for the blood pressure clinic, because remember, they have to do the same safety standards for the blood pressure clinic too. So there'll be numerous opportunities. More so than we've done in the past.
Are we still going to plan on having Saturday? Because, there are people that come that haven't registered and they register there. Do we need to think about the people that just last minute they say, oh my God, I got to get a flu shot. Today's a clinic. Do we think about maybe having one person doing a registration, maybe at the senior center with a nurse there to administer what she can, two nurses there to administer what they can. I mean, I am a nurse, so I'm available to help with all of the clinics whenever they are. So, but I think I'm concerned about the people who don't, you know it and I know it. People don't always keep things in mind right up front. They're like last minute, oh, today's flu clinic, I gotta go get a shot and I registered. Do you know what I'm saying?
Right, that's why there's numerous clinics. We're not just doing the, you're right. If we did Saturday, that would be a big problem. But since there's numerous ones, we could always schedule them. If somebody walked in, we could schedule them for next Tuesday or schedule them for a different day. So it's more, I think it's much more flexible.
So we're not gonna do a Saturday morning at all.
Right now, we're thinking not doing that. We don't want to do that big, large clinic. We want a small, controlled, registered clinic, just because of the precautions.
Okay.
Now,
But I
when we
think-
do COVID, now when COVID comes out, that might be a different story. But this is just for flu. And
Right.
I just want to remind everybody, there is plenty of flu vaccine. It's being offered. All the
Every-
pediatricians have it, the doctors, the pharmacies. And what's new this year, Kathy, is previously children could not get the flu vaccine at a pharmacy. So if you, mom and dad went to CVS, the children couldn't get it. This year they can, which is huge. That really takes up, that's a big help. It's a big help.
What
So-
about for us? That was my question. Excuse me, Kathleen. Stacy, what about kids coming with their parents? I think what I can remember, just help me, that it was 13 or over we gave the flu vaccine to. Is that what it was?
Yes, 14 or over, yes.
14 or over.
And that's gonna be the same for our clinics, correct?
Yes, so if someone calls up and they say, I would like to come in with my 3 children and 14, 16, 18, mom and dad and grandma, they can all come the same time and we can do that group and we'll schedule them that way. Yes.
And we'll
So
schedule
they're-
them through the health department in the town hall.
Right, and this way a whole family can come in together. It's kind of nice. If they have an appointment, the family can be done. We ask that people under the age of 14 go through their
Okay.
pediatrician.
Okay, and what's the start date for those vaccines like that, Stacy, for a family to come into the town hall?
Well, as soon as we get the vaccine in hand, we'll start setting them. We don't schedule until we have the vaccines, right in our hot little hands. Because we don't want to have to cancel. We don't want to turn people away.
Okay, how are we going to advertise this so that the community's aware that there's not necessarily going to be a clinic, but there are going to be multiple little clinics that they need to register?
Right. Same way we usually do. We usually put an ad in the newspaper, the free newspaper. It'll be on NCM. We will do all our normal news, talk about it every time. We'll have Tony talk about it when he does his Thursday talk. The selectmen can announce it. We'll just announce it like we always do through all our normal channels.
Okay.
And also, people can call the helpline, so we're going to work with the town hall helpline. We have to have that conversation with them, but we hope people can call through that number that everybody's used to calling, the citizens are used to calling, so that they can get information that way too.
Okay, so with our first go around, when we get this, we're going to give to emergency health workers, police, fire, EMS.
I'm not getting you, Kathy, clear at all. You're all broken up. Everybody's breaking up now.
Okay, can you hear me better
I
now?
have a question for Nick before we go on to something else.
Okay,
Sure.
I have a question for Nick in the testing.
can I just finish?
Nick?
Then can I just
Oh,
finish?
yes, please.
Can we, is the first round going to be for EMS, police, fire, and seniors housing?
Correct. That's the first 180 doses, Kathy. And we're actually going to go down to the police and fire station. And we're going to hit, there's different shifts. We're going to go early in the morning. We're going to go 7:30 to get the evening shift coming off for the police and the shift coming on. And then we'll also do it for second shift. So the 3:30 to 4:30, their shift there. And then also with the fire department, we're going to go down 4 times because there's 4 groups in the fire department. We want to make sure we get each group. And then after that, of course, they know that they're used to us doing these clinics. They can call if somebody was out, not in that day, and they can be done at our office.
Okay. Okay, go ahead, Carolyn.
Nick, I've been asked, and I don't know how to answer this. There are many types of COVID tests. Could you explain that to the general public? People say, well, I want to see if I've had it. And the antibodies, is there several things that they should ask for? Or, I don't know. You tell us.
Absolutely. No, great question. So there are basically 3 types of COVID tests that are available right now. The gold standard, the Cadillac, the one that we like to see is called the PCR, and that's the one you usually see on the news. It's the nasal swab. That is the test that we use to determine, if you have a COVID-19 infection at that very moment. And so if I ever talk to somebody, a Norwood resident that I find has been exposed to someone, that's the test that I'm advising them to go and get. That's the test that's used for getting out of quarantine with regard to the travel order, not overall, but that's the one that's the test, that's the most important test.
It's not a rapid test.
Not always. It can be, there is a rapid, there are a few places that still have those, have the ability to do it rapidly, I would say, like results within 30 minutes to an hour, but those are harder and harder to find. In most cases, these tests take several days to come back. The one that we've been seeing in the news, and the second type of test, is called an antigen test. And an antigen test usually gives you results within 15 minutes, sometimes less. It's not as reliable as the PCR test that I first mentioned, but it's usually what's referred to as the rapid test. And so some urgent cares are using that, and it's still a valid screening tool. But if I talk to a resident who I think has been exposed, I'm always advising them to get the PCR test. If they do get that antigen test, which is done the same way in most cases, a nasal swab, I want to make sure that they have both done, so that because if the antigen test is positive, we would assume that they're sick and we'll go forward. But I want that PCR to back it up, because that is the gold standard. And then the very last,
both of these tests are nasal swabs.
They can be, yes. Some of them can be done orally as well, and there are even some, though I haven't seen any yet, that they're starting to have home kits that you can spit into and send off. But for the vast majority of tests, it's a nasal swab. And then the last major type is the antibody test, and that's a blood test. And I've seen Facebook ads for this. Lots of urgent cares are doing this. The antibody test is what I call a curiosity test. We do not use it in any way to determine if someone currently has COVID. What the test does is it sees if you have antibodies potentially due to a past infection. But there are some limitations to the test that residents should be aware of, and that is, number one, these tests, just like this disease, is very new. So we don't know if there can be false positives caused by other types of coronaviruses, say a common cold, that would make you appear to have past antibodies to this test. And quite honestly, even if you get a positive result for the antibodies, it doesn't change anything for your daily life. We don't know if you can get COVID-19 infection again. We don't know if it gives you any sort of, these antibodies give you any sort of protection going forward. So it's not like a get out of jail free card, no mask, I don't have to sanitize anymore. And that's why I call it a curiosity test. So it's not used to make any determinations about return to work or anything like that.
Which would you recommend to the general public if they came to you and said, I need to get a COVID test?
So I would follow up and ask, why do you need a COVID test? But most cases, I'm going to default to the PCR, the very first one I talked to you about. I don't generally recommend people go get the antibody test. It doesn't really change anything. I don't want to discourage people from getting tested, of course. But yeah, I mean, if someone came to me and said, my mother has COVID, or I need to go somewhere that needs proof of a test, or et cetera, 99% of the time, it's going to be that PCR nasal swab test that I'm going to recommend.
Thank you very much. I think that's important to let the community know that there's a lot of questions. Well, which one? I had said that I have it, so I don't. When they have the antibody, they say, "Well, I've already had it, so that means I don't have it anymore, and I can go about and do my business." But that's not true.
You're absolutely right. That is not true.
Thank you very much.
Thank you.
Katie, do you have anything you'd like to add to the nurses report?
No, I think that pretty much does it. A good explanation.
Okay. Just don't want to leave you out. Okay. So are we all set with the nurses report?
Yes, thank you.
Okay. All right.
Thank you very much, everybody.
Thank you, Nick.
Thank you, Nick. Thanks, Katie.
Okay, so our next is old business. We're going to talk about the update on the Household Hazardous Waste Day, which is going to be September 26th of 2020.
Yeah, so just that's coming up right around the corner. We do expect to run it in a similar way with lining up the cars. Because everybody stays in their cars, we want to remind residents to stay in their cars. We think that it's pretty low risk in that aspect. Obviously, for the people working, there's going to be some more safety measures with face covering and ensuring that we're practicing social distance at the site. Kathy had a great suggestion to, instead of handing out the papers with the fees, that we make some signage. So we're working with a printing company and going to make take the fee list and make it on big sandwich board signs and get a couple of them so cars can see it as they start to line up and calculate, what they're going to owe in fees for the materials they're bringing.
What about the pens? What about the pens?
Yeah, so no pens and papers. We're not going to be handing those out.
Yeah.
Are we going to have to check identity? Like, I'm going to wait for them to get their wallet out and show me if they don't have a sticker that they're Norwood residents?
We still need to check residency. I think they could do that with their window closed. Just put the information up against the window. We're going to have to remind people, because they're used to a different system, but we just want to make sure we're able to maintain social distancing. Everything takes longer in COVID, so it might take a little longer to get through. That's all.
That's leads into my question. Do we need to think about I know it's a long day as it is, but do we need to think about maybe extending it by an hour so that because of the length of time it's going to take to do all of this, or do you think 8 to 11 is fine?
Do you want to live?
Yeah.
I think 8 to 11. I think 8 to 11 is fine. Although it's going to be probably more people because we didn't have the one in the spring. But by the same token, we're going to be standing out there with masks for 3 hours with no chance of taking a 15-minute break here or there, unless you want to get run over by a car. So
I think the Gal and I had discussed that, and there's enough of us that are still volunteering. We're all going to be wearing masks. There are going to be hand sanitizers available, especially to the person collecting the money and people that are at the different stations down there. But I think we can switch people out and give some people a break so that we're not all standing for 3 hours, not all out there for 3 hours. I think there's possibly enough of us to do that. My husband had made mention to you, Gal, just so you know, that they use sanitizer stands for the elections, and that those are right outside the hall of the public health department. So maybe we could use a couple of those, especially with who's collecting cash, or we do accept checks as well. Is that correct?
Mm-hmm. Yep.
So if people want to.
My suggestion would be, for myself, I would probably try and wear a pair of gloves, the rubber gloves, collecting the money. Now, how that will work out, I don't know, as far as counting and stuff like that. The other thing I was going to suggest is the people that are facing the cars and whatnot get, as well as a mask, get one of those plastic shields, that they clip onto your hair. The kinds you see in the on the TV for the different health department people wearing, as well as a mask. I don't know if that's possible or
You-
not.
Not 90 degrees, because we'll be all passing out.
Yeah, well.
You mean for
know,
us street people that, yeah, I don't mind that, because the ones that were sticking our heads in the cars to help
Yeah.
the old people get their license out and stuff.
Yeah. I don't know. Is that possible, Sagal?
Yeah,
Okay.
yeah, for sure, get face shields.
Yeah. And then we can do masks as well as face shields, and that way, I think I would feel more comfortable with the gloves and the masks and whatnot. You know, because they're always chit-chatting with the people that are looking at the licenses and the money, you know, when you're collecting the money and whatnot, so.
Yeah, and we just
Just
have to
one-
make sure we keep that to a minimum.
Yeah, exactly. Like, stop talking, give me your money.
Do we,
Well, you know what, and that's a very good point, Joni, the talking, excuse me, Kathleen, but when you're out in the street like Kathleen and I, they ask you a million questions. Well, I have a TV, I have a set of tires, I have mercury. Blah, 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 blah. You know, I mean, we spend a lot of time with those cars, checking their ID and talking to them nicely because that's our job. So we spend a lot of time out there, right, Kath?
yep.
They wanted to show us everything they have.
I know.
So I don't have a problem with the shield, Kathy, do you?
No, I don't have a problem with the shield. I just know that they are hot, so that if it's a cool day, we're okay. But if it's a hot day, we'll be taking them off because they are hot.
Okay.
So, the other thing was,
Well,
do we have like a money box or something, Sagal, instead of, because Joan always puts it in her,
My little green jacket, yeah.
it's probably not a safe place to be putting it because I know it's not contact, but all of that money is basically, if you think about it, it could be contaminated because people have been talking while they're handing it to you, et cetera, et cetera. I'd rather see it maybe go into some kind of box or something as opposed to a packet.
Yeah, no, that jacket, I would absolutely, when I get home, take it off and wash it. But if I have a box, Kathy, it makes it hard because then there's cars coming both ways. And if I had the box, I'd have to leave it on the wall. And, you know, I wouldn't be able to see who has access to that box. So the pocket always worked for me. And, you know, I don't mind washing the jacket, but I don't know how else to do it, other than stuffing it in there. And when Sagal comes by, I hand her a pile of it. So a box really doesn't work.
Well, I'm trying to keep spread down, what I'm trying to think of ways
Yeah.
to, you know,
Well,
we may have to think about where we stand as opposed to, you know, I don't know, it's a little tenuous, but we may have to think about where we put the person collecting the money as opposed to being top of the hill, maybe down at the bottom of the hill. I don't know. I think we need to think about that just because of those things. There are cars back and forth, and if we needed to give you relief, somebody has to walk up the hill. Maybe if you're down the hill, we have a better setup where if you need to take a break, somebody from down there can come and take over, give you a break.
Mm-hmm.
We have a box that the money is in as opposed to, you know.
Okay.
You know,
That's why I suggested the rubber gloves, you know, the gloves, because that would eliminate, you know, any handling the thing. And I just figured with the rubber gloves and stuffing it in the pocket, unless you want me to get some kind of an envelope in my pocket that I stuff it in.
Yeah, I think even with the gloves, we're gonna make sure that you know, put the hand sanitizer either on the gloves or on the hands.
Yeah.
I think maybe thinking of reworking the money location where there's a little more space, because that is kind of a dangerous location and it forces you really close to the cars. So maybe moving it down, and we can give, because down right before the curve is where we give people direction on where to go. So maybe
Okay.
combine 2 stations and then just having one stop. Where we do money exchange and tell them where to go, and maybe even having it on the passenger side of the car, although a lot of people come with more than one person, not just the driver.
Right.
But an area where you could get a little more space, but still communicate, and still not only communicate about the transaction, but communicate this is where you need to stop, because a lot of times they
keep
think
on going.
they're
Right.
run over your toes, right?
Yeah. Yeah.
So if one
Wherever
place,
you want me to stand is fine. It, you know, that doesn't matter. It really doesn't. But I'm trying to think of how it would be safe for the money other than, no, I don't know. Whatever you guys decide is fine.
Well, maybe if you're down the hill, they can put a small little table with the box on the table.
Yeah, they could do that, but then you'd
If
have
you
to
got a
put
little
it,
bit more room.
well, you'd have to put it between the cars going up and the cars going down.
But there's a little bit more spread there.
Not a lot, but but they'll be turning and stuff like that. So whatever you want to do is fine.
The reason I'm thinking that is because we have a sanitizer stand. You're gonna have to have something that you are putting sanitizer on, whether it be your gloves or your hands or what the sanitizer on. You're not gonna want to be bending down to the ground. So if we
No,
use
I
one
would stuff the sanitizer in my pocket, and then before each car, then I could do that. Whatever you want,
Yeah, I'm picturing down by the curve is to have the cars stop once, have the money collector with a stand with hand sanitizer, wear the gloves and just sanitize the gloves, between every interaction.
Oh, yeah.
Face shields, face coverings, stepping an area where you can step back from the car but still have a conversation. Encouraging people to keep their window open. Maybe they don't roll it down all the way. You just open it a little so you can talk. So I think we can create some barriers and some safety measures. And you know what? It's a good time doing it this way. We might have to tweak it a little when we get down there. Figure out that's
Well, I also think it might give the people a chance from when they talk to Carolyn and I up at the front about what they have. Now they have a chance to get down to you. They have their money ready, whether it be a check or money or cash or whatever. They have it ready. You don't check their IDs because we've already done that.
right.
And there's more space down the bottom. That's
Okay.
Always been a big concern that we're between two sets of cars and we don't need to get hurt on top of everything that we do.
No, that's fine. That's fine. Like I said, whatever you guys decide is fine. Doesn't matter.
As far as the other operations, I think there's plenty of space down there for everybody to socially distance and still do the collections. And when we do our messaging, we will remind residents to wear a face covering because they will be getting out of, rolling their window and having a conversation, and to stay in their cars. Those are going to be very important.
Are we going to have sanitizer at each of the stations down below so that the staff can, if they have to for any reason?
Yeah, we can get a couple more than just at the payment stop. Yeah, that's a good idea. Get a couple stations throughout.
Yeah, just in case anybody feels they need to, because there's no place to wash your hands down there.
No, that's good. Oh, that reminds me, Sigal, will you make sure that they open the bathrooms upstairs so we don't have to use those porta potties, please?
So they give us a key.
Big letters, yes. And the other thing is, have we talked to the sheriff's department to make sure that they're coming?
They are not running their community service work programs during COVID. We have talked to Public Works and we will double the amount of Public Works employees down there.
Wow.
Well, that's right.
I'm not surprised at that. I kind of thought that because they don't want to bring anything possibly back to the prison or wherever so.
It's a high-risk environment when you have, both the prison, they don't want to bring anything in, and we also don't want that exposure. When they're in a program like that, it tends to be high risk. So I think it does make sense.
Okay. It's too bad Mikey's not still the sheriff and we could figure something out, but that's okay. If DPW is willing to do it, then fine. Okay.
Okay. Anybody else have any questions about hazardous waste?
No, thank you.
Okay. All right, moving along. Impact Norwood. Aubrey?
I know, I was on mute. I started talking. Good morning, everybody. I'll keep it short. I'll just share a few highlights. Our youth ambassadors, I'm so impressed by them. They took it upon themselves with very little guidance from me to develop a social norms campaign. And I met with one of them on Friday and they showed me everything that they had come up with. And I'm really excited that we'll be launching that campaign soon. So that's coming up. Right now, we're going to be working on testing the messages and make sure it resonates with their peers and other folks in the community. So that's coming up. The other big piece of news tomorrow, Sigal and I, and actually a representative from our Youth Ambassadors program, we're going to be interviewing potential candidates for the program coordinator position that's open. And we have a youth ambassador representative because this person's job is going to primarily be working with our youth program. So we want to make sure that whoever we hire is a good fit for our youth. So we want them to have a voice as well into who gets hired into this position. And then last big piece of news that I'll share, coming up on September 24th, we have a virtual coalition meeting at 3 p.m. I'll be putting the information for that meeting up on the Impact Norwood website. This is a great meeting for anybody who has never been to an Impact Norwood meeting to attend. I'm going to be kind of doing a presentation, revisiting the strategies that we've selected, where we are on those, and then looking at some new data that we have in the current global situation, I guess the pandemic that we're in, and how that impacts our work. And we'll be revisiting some data points to select some new strategies to address youth substance use in our community. So yeah, those are the big things for me. So, any questions?
Yeah, I'd like to ask on the new position, is this something in our budget, or is this something that we have a, oh, what do you call it for?
Grant.
I can answer it.
Thank you.
Or go
Hard work.
ahead. Okay, so it's in the Dfc Grant Budget. So this comes out of the Drug-Free Communities grant that we have.
Okay, how long is that grant for?
So we're entering year 4. We have after year 5, we'll write the grant again, we'll reapply, hopefully we'll get it. And then we have another 5 years after that.
Okay, what happens if year 4 we don't get get the next grant?
I'll let Sigal take that one.
Okay.
Yeah, I've been, that's, constantly hanging over us. And we have seen a lot of communities around us, what I call a little gap year, that maybe you don't get funded your first time you apply, but you might get funded the second year. So you have a year where you need to sustain the program and fund it locally. I've definitely talked to FinCom about that. We've talked about it here in our budgets, and the manager's office knows that, it looks at FY21, we're going to have to request funding for the Drug-Free Communities program because we won't know if we get the grant by the time budgets are due. So I would submit a request to fund the program locally, hoping that we don't need to use it because we will get the grant. I think we have a very strong application. We have a very active coalition. So I'm going to be optimistic and say we do get funded for the next 5 years immediately and not have to worry about a gap year. But it's definitely something we need to keep an eye on.
What was FinCom's answer, Sigal?
I think
How did they feel they could deal with it if, we have to wait?
Yeah, I think I don't think they give you a clear answer because of course they have to look at the whole budget, but I think they know it's coming and they understand why.
Thank you, Sigal.
Anything else?
No, that's it. I won't get too detailed in my report because I want to keep us on time. So that's it. Those are my big highlights.
Thanks, Aubrey.
Thank you. Great job. Okay, moving on, our sanitarian report. Angelo?
Good morning, everyone. Can you hear me?
Yep.
Yes.
Great. Before we get into the food piece, I'd just like to fill in the board on several other topics regarding the pools and the skating rink of Boston. So may I do so?
Sure.
Of course.
Great. So we had 7 seasonal pools that were open this year, including one of the town pools. Just want to let the board know that there were no COVID-related issues observed during any of my inspections this year of the pools. And we also did not receive any complaints of any COVID-related issues from the pools operating this year as well. So I just want to thank the seasonal pools for that. Okay.
Great.
Great.
Then since our last board meeting, we had about a dozen non-food establishment complaints regarding COVID-19. These establishments included barbershops, hair salons, auto service establishments, workout facilities, several car dealerships as well. The majority of these complaints included face coverings and social distancing requirements. And you would not see that in, obviously, the food report. That's why I'm mentioning it here before we begin the food piece. And the last topic I just want to fill the board in is on Skating Club of Boston. I did a walkthrough on August 28th of the facility, which, by the way, is a very impressive facility. So if you have a chance to walk it, it's massive. Anyway, so they plan on opening.
Can you get us in there?
I can try. We can talk offline about that if you like.
Okay.
But no, they plan on.
I
Yes.
took a tour with the selectmen last night. It is beautiful.
I'd love to see it.
Sure. But they plan on opening the end of September. So I did a walkthrough of all the areas, including the food areas, of course. So I will be doing an inspection of the food areas before the end of the month to hopefully permit them to begin their operations of the concession stands and their banquet kitchen facility as well.
Okay, well, that might be a good time to have us roaming around, looking around while you're inspecting.
Sure, whatever, absolutely. We can touch base on that, sure.
Their banquet facilities, what is their capacity, Angelo?
Oh, I forget the seating.
Talk about banquets. I mean, that's huge capacity.
Yeah, there's a balcony out there as well. I mean, it's beautiful, but I forget the capacity. I want to say it can be 200, I think.
Yeah.
Wow,
So there won't be, having functions of 200 people there at this point in time, but it's a very, very large.
Are they going to rent out to the general public as well, or are they keeping it within their Skating Club of Boston people?
I am not sure about that.
Okay.
No, they're gonna rent out to the general public for things.
Right.
Well, it's a huge facility. It's huge as far as the dining area. There's 2 separate dining areas, and they're very well aware of social distancing. They do have something coming up. I think it starts the 25th. They have a program that they're not allowing anyone other than family members to, and you can easily social distance in the main skating rink. They can easily be 6 feet apart. There's so much space there that there shouldn't be a big problem, and they know about it, so they're, they want to work with us there. I talked to the general manager last night, and he said that he looks forward to meeting with all of us. And I didn't think at the time, I should have asked him at the time if we could have set up a tour, but I didn't think of it. But I have his name. I can probably reach out to him and ask. He said anybody that wants to, they can tour. So.
Oh, this old hockey grandmother would like to see the facility.
Go ahead, Angelo. Sorry for
Thank you, Angelo. Thanks, Kath.
Absolutely, no problem. Do you want to do the new food establishment report? Look at that real quick.
Sure.
So we had the Middlesex Integrative Medicine Facility open a couple of weeks ago on Astor Avenue. I think that's been open about a week now. We had the new ice cream truck in town, Sweet 16 ice cream, which was permitted several weeks ago. And Hartney's that you see there is the residential kitchen. And what they're doing is they're receiving prepackaged ground coffee to their residential kitchen, and they're shipping it out from their kitchen to different companies. So there's no food handling, there's no food prepping, there's no refrigeration or anything like that.
Okay, are they going to keep the animals out of the kitchen?
But they are going to keep the cats out of the kitchen.
What are you doing there?
I'm just playing with this bell.
Oh,
Go ahead.
And the facilities you see, or the establishments you see below, those 6 facilities there, those are all pending. They were sent out their letters of conditional approval, just waiting to hear back from them regarding the scheduling of their final inspection.
Okay, I spoke to Spot this morning, and it seems that all their mechanical stuff is, their plumbing and sprinkler system and everything else is good. However, the people that are putting in the floors used the wrong material. So now they're going to have to rip up all the floors and replace them with stuff that is acceptable to the Board of Health. So it's probably going to be longer than shorter.
Okay. Great.
So,
Can I ask you one other thing? Can you just mark the ice cream vendor these, I didn't get out of my fast enough, but they're still running their bells while they're moving. So it's, remind them that they're supposed to ring their bells while they're moving. And
Sure.
one, I can't tell you the company because then the truck was all white. It didn't have a name on it. So I don't know who it was that was ringing. I'm up and down my street, Father Max, and they were get.
Yeah, the trucks that are permitted in town do have identifying information on both sides of their. So the one that doesn't have any trucks, I'm not familiar with.
Okay.
But I will remind the ones that are operating in town about the bell.
Okay, well, if I see them again, I'll stop them.
Sure.
Okay, thank you.
Get your whip with you too, Kathy.
No, I just have.
Bless you.
Okay, girls, thank you.
All right, go ahead, Angelo. Thanks.
That's it for the new food establishment report. If you want to go over the actual inspection report now.
Can I ask
Yeah.
one question? What
Yeah.
is non-spice? What is that a,
Norwood Spice is taking over Victoria's Cafe on Washington Street.
yeah?
Right.
It's going to be an Indian cuisine location.
What is it?
Indian cuisine.
A what?
Indian.
Indian cuisine.
Middle Eastern cuisine?
Yes.
Oh,
Indian cuisine.
Oh, Indian.
Yes.
Okay.
oh, Indian. Okay.
Thank you.
You're welcome.
Are we gonna go down page by page? Lucky you, Angelo. Crushed peppers.
Sure.
I'd like to put them on the list if we could.
I'm looking for my. Is that the only
Okay.
critical crushed peppers? No.
Oh, no. There's a few other stashes, doesn't look too good either. Well, it says, general sanitation observed up to standard, so whatever that means, but, crushed peppers doesn't look too good. And, Dollar Tree stores, talk to me about that, Angelo.
Was that regarding the complaint?
Yeah,
So the company.
Don't.
page 2 of 11.
So the company sent out an email to all the managers and all the stores through the United States. And they
Yeah.
mentioned that they don't want any of the stores that are in states that are not requiring face coverings for those stores to enforce the face coverings, which did not include Massachusetts. So the stores that are in states that are enforcing face covering requirements, they are required. Those stores are required to enforce the face covering requirements. Okay, so this employee, somebody who called, they really didn't understand the email that the company sent out. They thought it was a general email to all the stores, but it was just specific to each state, to the stores that operate in each of those states. So the states that have the stores that are operating that don't require a face covering, they don't want those stores to enforce the face covering requirement because those states do not mandate it. That makes sense?
So that means that they do or they don't?
In Massachusetts, they have to, correct.
Yeah, okay, that's, yeah, okay. And I'm not done yet.
Didn't think so.
I was trying to be good for the length of time. All right, Hotney's, you already explained that. McDonald's, did we double check to make sure that they had everything done? This is the one on Providence Highway?
No, this is the one on Broadway.
Yeah, well, there's one on page 4 for Providence Highway that had to close for 24 hours.
Yes, they sent me a checklist of all the areas that they cleaned, and all the staff
Okay.
members were designated to clean certain areas. They did sign off on the checklist, and it was sent to me for review. Once I did review the checklist, those that were clean and sanitized, they were given authorization to reopen and begin food operation.
Okay, so they double checked with you before they reopened then, right?
Correct. Yes.
Okay. And Limey's Pub. I'd like to put them on the list for double checking again.
Sure.
That's page 5.
You done, Joan?
Oh, no, I thought I was waiting for Angelo. Yes. Oh, no, wait a minute. How about Norwood's Golden Bull?
No, with what?
Golden Bull.
Oh.
Page 7. Sounds like we need to keep our eye on them.
Yes, so they had some food that had to be discarded because of
Right.
improper temperature. So
Right.
they did that voluntarily while I was there that day. I did
Uh-huh.
go back. I did go back the day after to check the same unit that was repaired,
Yeah.
and the unit was running at proper temperature. So they were authorized to use a unit to again hold all TCS foods.
Okay. You think it's something that we need to readdress after that? Like put them on the list?
That was for the reinspection. They have a thermometer in there. The company did come in and service the unit. I think he needed, I don't know if he said he needed glycol. I forgot what the owner said that the issue was. But the unit was running properly while I was there, and they were again authorized to use that unit to store their foods back in there.
Okay. All right. McDonald's on Broadway. I assume we're all set with there?
Yes.
No, I want them added to the list.
Okay.
That's it.
Yeah.
The fact that he had to go there twice. First of all, he did that, and then we go back because we had a complaint.
Well, they had a COVID.
First to begin with, and I really think
Uh-huh.
that they need to be just added to the list to them on their toes.
Okay.
Of the inspection. Okay.
Okay. Shaw's Supermarket. What's going on with them? Page 10.
Yeah, there were 2 criticals observed during my inspection there. They did correct the violations while I was there. So there was no need for me to do a reinspection.
Okay.
Overall, it was a good inspection for such a large facility.
Mm-hmm.
And there were no COVID-related issues seen during the inspection as well. I don't think there's any need for any further action, to be honest.
Okay, what happened with the shelving unit inside the meat cutting room that had excessive rust and flaking paint?
Yeah, he put in a service call while I was there to have the unit replaced.
Okay,
And he is to contact me once they receive the new unit.
okay. Have they received it yet?
No,
Okay. How long did they think?
I can reach
Yeah.
out to him this week and ask him. That's fine. I can do a follow-up.
Yeah, because it was the 17th of August, so 3 weeks, yeah. Yeah, I'd like you to do that if you would, please. So, and the last thing is the Norwood Country Club. How do you figure that they can tell whether you're in the same thing? I mean, do we do a DNA test on them or?
Yeah, I guess you're gonna have to take their word for it, you know?
Okay. Right.
Yeah, so when they use the cart to golf, you have to be in the same household in order to use the cart.
Right.
For 2 people. So, yeah, that's what he said. He said, I don't know what to, he's like, do I take their blood? Do I ask for their, what?
He's right.
Yeah.
You can only ask them if they tell me they live in the same household, then, I mean, can't really prove it, you know? So,
No.
but they are trying there. I know it's a difficult thing to control, but John, who I have a good professional rapport with, and I've dealt with him in the past, and he does his best. He really does. He keeps me in the loop on certain things, and he does ask a lot of questions. So he is trying. So.
Good. Okay, and last but not least is the Beirut. One right under it, page 11. Got it?
That's right. So this is the second complaint regarding face coverings. The first time that I received a complaint, the first complaint I received, I did go there, and I didn't see any non-compliance to the face covering requirement. I did see that wearing properly. This was a second complaint regarding the face coverings.
Yeah.
I did call the owner and just about the requirement.
Ellen, is that you banging around? Knock it off. Okay, go ahead.
So anyway, so I did call the owner for the second complaint, just to remind him. We actually reviewed the standard on the phone with him, and he did say that he will comply and make sure he reviews the standards with his staff.
Yeah, him I'm not a big fan of, so I would like to add him to the list just to check the masks and whatnot, because I'm sure at any time you can go in there and find somebody without their mask. What do we do now if it's more than 2 times? Is there any fine involved in this? Is it a regular fine, Segal, or is it, we don't have a thing in the listings that has that for a fine?
We cut off the governor's order fine on noncompliance for the safety standards.
Okay, all right. Yeah, it just, I mean, that's a food place, so I would expect them to have that, the masks on at all times. So, even if it's a drive-by, you can check their masks. Are you there?
I'm here.
Oh, okay. All right,
Is
on the list, but a drive.
that a $300 fine, Segal, from the governor?
Yes, there was a
think so.
recent change. Yeah, they made it allowable under our 21D ticketing policy, so that we can fine 100, 200, 300.
Okay. So if we gave them 3 tries and they fail, we could charge $100 fine for that, correct?
Right.
Or-
Just like we would for any, food violation or something like that.
Okay.
And the mask has to be over the nose. It's a little secret that some people don't know.
Correct.
Well, they know
Thank
it,
you,
they
Angel.
just don't, choose to use it.
It's
Okay, I think that's it.
To be honest, a lot of the complaints that I receive about face coverings, when I do go there, if they're wearing their masks properly over their nose, there's really, if they're compliant and I don't see what is noted as the complaint is really, sometimes they'll say I was there on a Saturday night at 9 p.m. and people were not wearing masks, and I go there on a Tuesday morning or Tuesday afternoon.
Right.
It's hard, For example, I got a complaint about a hair salon where over the weekend, the stylist wasn't wearing her mask. And then I go there, I think it was like a Wednesday afternoon. She was by herself and she wasn't wearing a mask, but there was nobody in the location. So really, she doesn't have to wear a mask if she's by herself, If somebody does walk in, she'll have to put it on, obviously, and so does the customer, but.
And why did you have to go to this hair salon? Did she have food in there that, is she licensed through us, that she had to be inspected?
It's usually information we get from the Department of Labor Standards. I usually get forwarded an email for non-compliance to the non-food establishments, and I do
Oh,
go check on them during my time in the field. If I'm,
I didn't know that, Angela.
Yeah. So, and again, you won't see them in the food inspection report. That's why I did mention it in the beginning of my session here regarding the COVID-related complaints for non-food establishment.
Yeah, Angela's been doing all our boots on the ground inspection of all those complaints that we've been getting regarding COVID safety standards.
Plus the inspections.
Yeah, I'm sure it's a lot of work.
Thank you, Angela.
So thank you.
Thank you, Angela. Good job.
Thank you.
Me too.
Okay, moving along, direct report. Rep, Segal.
Sure. I just wanted to draw your attention to a couple policy changes. Big one that the governor issued Executive Order 49 on August 28th, and that was really to address the gap in childcare with the hybrid models in a lot of the school districts. So it really did three things. It expanded existing early education and care EEC license programs to allow to operate during school hours, because there's actually a law that says that they can't, because obviously kids are supposed to be in school. So for school-age children, licensed daycares can now operate during school hours for those hybrid online learning days. The second option is to create a new remote learning enrichment program. It's sort of an exemption from the licensing process. This one's really huge because it really puts the onus to review and approve these programs on the local municipalities without much information. I'll get a little back to that in a minute. And then the third option allows to privately for parents to put together parent cooperatives to gather up to 5 families together under, in one household, supervision of one adult to assist with the online learning days. So again, that second one is really, it's difficult. They gave us a basic outline of the requirements needed, but a lot of the forms and the EEC exemption process is not up on the website yet. So we're really kind of scrambling, both on the municipal side, we're trying to put together a program for our employees, but also private entities within our community are looking to do this also. So I do encourage anybody that wants to do it or interested in it to look on the EEC website to at least see what's going to be required. And then once we get the forms and the actual exemption license process is stood up, we can start submitting for that. But at this point, we know what's coming, we just haven't seen it yet.
So is that something that's going to come through the health department, or is it going to be in conjunction with the schools or by the schools itself?
The governor's order and EEC haven't really specified if they say it's the municipality that must approve it. So to be honest, I think it's in a combination of health, schools, police, because there's background checks issues, fire, they need a fire inspection, they need a building inspection. So it's quite a lengthy process with a lot of departments involved. As far as who's going to be the official sign off, we haven't decided that.
You break minutes ago.
Everybody else hear me?
Yep.
Yeah, okay. So like I said, we're working with the town to assist setting up a program for municipal employees. I know Extended Day is looking to set up within the schools a program for families. And like I said, there's a bunch of private entities in our community looking to fill this gap also.
Wow, that's a huge thinking.
And then just with schools, we continue to work with them. We held virtual meetings with all the school buildings to help answer questions for employees. And we continue to work with them to make sure their plans meet the safety standards and that they're following all the orders and that they can open in a smooth, safe way. And they've been a great partner in that work. Also, just wanted to talk about the travel order. So what happens is anybody that travels to Massachusetts or returns from a trip into one of the high-risk states has to fill out a travel form. And then that information is available to us at local health so we can look at it and see how many people are going back and forth and how many people might be under the travel quarantine. Travel quarantine is not like a regular quarantine. It's just a precaution because you went to a high-risk area. It doesn't mean you had a known exposure. So you can get a test either 72 hours before you come or once you get here and then be released from that. So there's, as you can imagine, it's a long list where people are constantly changing. Waiting for a test, pending a test, then, I'm going to leave next week. So it's a very long list, but it's not like we have, I think I wrote on the report, 311 travel forms. It's not like we have 311 people in travel quarantine. That's a list since the beginning, since August 31st, and people are on and off all the time. I did include in my report just showing the high risk states.
Okay.
Sigal, now it's 72 hours before they leave the state or 72 hours after they return to the state?
So if somebody was coming, let's say from Florida to Massachusetts, they would get it 72 hours before they come to Massachusetts.
Okay, so they'd have to get it done in their home state or the state they're traveling from. Okay. Right. And then who do they give the results to? So
that they would input it with the online travel form, which is a state form.
Okay. All right.
And then if they come to Massachusetts, then they can get it once they get here, but they need to be quarantined until they get those results.
Okay,
They
all right,
can't leave their hotel or their house until they get the results.
they get the results. Okay. All right.
We talked a little bit with Angela's report about complaints. I wanted, we do track the COVID complaints that we get. We've gotten 95 COVID complaints since May about safety standards. So like we said, that's a lot of work, and Angela's been doing the bulk of that. But Jen also tracks that in a spreadsheet, so we know we can keep account of the volume of that.
Good.
And then the rest of my report is just going over the case numbers. Just to update you, I pulled them this morning, and where's my sheet? Here we go. Right now we have a total of 641, but I think what's a lot more accurate is the reporting the state's been doing lately, which is the previous 2 weeks. So the report that will come out tomorrow will consist of August 23rd to September 5th, that 2-week period, and that will that's how they calculate our rate per 100,000. That's average daily case count per 100,000, and that's what determines whether you're green, yellow, or red. I do anticipate, that we will be in yellow again next week, but I do think our rate will be much lower, back into the 4s. We did last week go up into a 6.7 rate. The week before that, we were 4.3 maybe. So I think we're back into the 4s. So I'm hoping that was just a little blip and we continue to go back into green, but we'll see week to week what that presents. I mean, still, we had, like I said, a little spike with 11 cases the week of August 16, 10 cases the week of the 23rd, but I do think that's going to go down the next week.
Okay,
So nothing
11
will
and
change if we go up. If we go up, Sigal, to the red, what will change for the town of Norwood? Nothing, right? Will it change for restaurants and barber shops again, or will anything change?
Oh, we lost her.
yeah.
Maybe that did it. Katie, maybe you can answer that.
Sorry, I lost her. I didn't hear your question. I didn't hear your question, Carolyn. I'm back.
My question was, will anything change
Can you
with
hear
the
me?
variating
No?
if we go up to red? It's okay. We're not going to do that anyway. So.
If we go up to red and we see red maybe for a couple weeks. Oh, I'm sorry. Can you hear me? Someone give me a
Yes.
thumbs up if you can hear me.
Now,
Oh, okay. Yeah, we want to see if it's a trend. What we would hope is that it wouldn't be a trend. It might just be a little blip, and that's what I'm hoping even the spike into yellow was. I think if we see red for a week or two and we don't have something to point to, like maybe a known cluster, let's say in a nursing home or something like that, that we would need to have conversations about changing some policy and pulling back a little.
okay.
As we do sort of go up into yellow even, I want to remind residents that we still need to be vigilant about the social gatherings and the face coverings and the social distancing and the hand washing. It's sort of a reminder that we are, our numbers might be low, but we are still living with COVID, and we need to make sure we all are vigilant in those safety measures to keep the numbers low.
Should we send that kind of info out to all the the restaurants, just in an update for the fall as we head into the fall, that we're still in a pandemic and that these requirements still need to be met and not fall back on with all these COVID complaints?
Yeah, that's something we talked about internally, especially where in the last 2 weeks we had some incidents at food establishments, is to send out a reminder of the safety standards, and that, as we can go into the colder weather where outside eating might not be as big an option.
Yeah, I think we should, and remind them their capacity size, so that we're still complying, and that fans and air conditioning and, heat, what does heat impact COVID? Does it amplify if you're eating inside and the heat on? I don't know that. Is that a question that should be answered, or do we know that answer?
Oh no, did I lose you?
Oh, did they-
Stupid, right?
We lose her again?
Yeah.
It's okay. We'll start
Lost
with
you
just
again.
sending the letter out.
I apologize.
That's
It's
okay.
I'm good for now. We're good.
Right.
We'll find
I
you
missed
through the week.
question.
The question was again,
We can talk about it.
I know that fans
Yeah.
were not safety. So we're getting to the season where fans are going to be put away. So does heat impact the activity of COVID? Does it bring it up? I mean,
So like when we're talking about HVAC systems, we want to make sure to bring in as much fresh air as possible. And in the heating season, that impacts your costs. Obviously, if you bring in cold, fresh air, you have to heat the air more in the system. So yeah, we want to remind them to not start reducing the fresh air intake because it gets more costly to heat up that cold air. Changing filters, you know, things like that. So it's the same aspects we deal with cooling and heating in the HVAC systems in the winter and the summer, because either you're cooling the air or you're heating the air, but we really want to encourage as much fresh air as possible into those systems.
so that's a very difficult thing to balance for restaurants and, you know, places like barbers or nail places to have the heat on, but still have air open. I mean, windows open for the comfort of customers, right?
Either yeah, in a smaller environment where they might not have a big HVAC system, yeah, we're talking about opening doors and windows as best as possible. Understanding the middle of winter, that might not be capable.
I'm just trying to find a balance for people, restaurants, so that they would, you know, how to manage this. But I guess we'll manage it as time gets closer and just try to understand what is best and how it can be done. Like, you know, in the winter, you're going to need a screen too on the door too. So that's already done with restaurants. Every restaurant has a screen.
Right. And again, I always want to focus back to how the virus is spread, and it's mainly person to person. So the number one things I want all of our businesses to be focusing on is the face covering and the social distancing and the hand washing. Those are where you get your biggest bang for your buck as making it a safer environment. Cleaning surfaces, you know, important. Ventilation, important. It reduces the risk a little, but the biggest impact is the social distancing, because the number one way you're going to get it is person to person. Coming in close.
So if you just send that letter out and highlight that again, I think that's going to be very helpful to everybody. Thank you, Sigal.
Great. That's all I had. And I just list my meetings if you have any questions about some of the other activities.
Nope. Hey, Stace, what's going on? Haven't heard from you.
I did a whole presentation on flu vaccine.
Yeah, well, that's that's called
Did you
short-term
see
memory
that,
loss.
Joan? You want to hear from me?
I want to hear
Katie, it's
what?
lovely to meet you too.
I didn't hear that.
I'm all set. Thank you. Katie, welcome.
Okay, board's agenda. Joan, do you have anything else to say?
Thank God, no.
Thank God, no. Carolyn?
Nope, my list is checked. Thank you.
Okay. I just wanted to reiterate just what Sigal said, is that since a lot of the public are watching, that we need to be vigilant with masks, social distancing, washing hands, using hand sanitizer. We know that it works. We know that it's helping to keep. We need the public to be vigilant about it as well. So,
Hey, Kathy, I just thought of something. How about if, when the cars are coming up, that we have them spritz their hand with sanitizer and then hand over the money?
yeah, we could do that, I guess.
That was just a light bulb. Okay.
Okay, do we have our next meeting set? No?
No, we need to do that.
Jen?
Yes.
So October,
Please, yeah.
is Tuesday a good day for everybody?
So far,
We want to do it the Tuesday after Columbus Day, or
Yep,
that would be the 13th.
10:30.
Yep.
Sigal, are these meetings still okay on Tuesday? Because you have a general meeting with the town hall. Are these, make it short for you? Do you have to run out at these times, or?
The 10:30 time works because we have a department head meeting 9 to 10, which usually runs over, but 10:30
Oh, so
works.
it's just 9 to 10. Okay, that's great. I just want to make sure. Okay.
Okay, do we want to go into November so that we things?
don't everybody
17th?
November?
The 17th, 12th? Which,
Which one?
The 12th is the day after oh no, the 10th would be the Tuesday before Veterans Day.
But that's only 1, 2, 3, 4. Right, mine was 5 weeks. That's 4 weeks, whatever.
Yep, that's fine. What's good for everybody? The 17th?
I don't have my book with me, so whatever day you pick.
17th is fine for me.
Okay,
Me, good.
okay.
Do we need to go into December or do we have enough for the two?
Big enough.
Okay,
Okay.
Okay, I'll see everybody at the,
we make a motion to adjourn.
I will make a motion to adjourn the meeting.
Oh, second that.
Okay, welcome aboard, Katie, and all in favor?
Hi.
Aye.
Meeting adjourned.
Okay.
Thank you.